Examination of the respiratory system begins with inspection.
Inspection is always done on bare skin.
Immediately determine whether or not your patient is in respiratory distress.
So looking at my patient, I don't note any respiratory distress, and those signs would include any difficulty breathing, any sweating, any cyanosis or tripoding. I don't see any nasal flaring or any lip pursing, and no accessory muscle usage.
Continue general inspection.
Inspecting the patient's chest and back, I don't notice any deformities, any edema, any discoloration, any lesions, or asymmetry.
Observe respirations.
For respirations, you want to look at the depth, the rate, and the rhythm.
Inspect integument.
So looking at the patient's skin, nails, and lips, I don't see any cyanosis or pallor.
Inspect chest configuration.
So looking at the patient's chest, I'm checking for symmetry and for any deformities. I don't see any barrel chest, pectus excavatum, or pectus carinatum.
Examination of the respiratory system continues with general palpation.
So initially, I'm just going to generally palpate for any edema, any tenderness, and any deformities, step-offs, anything like that. Any tenderness at all?
Nope.
Okay. Please remember that a lot of chest pain complaints are musculoskeletal in nature and not due to heart or lung disease.
Bony palpation.
So first we're going to start with the clavicles, the suprasternal notch, the manubrium, the body of the sternum, the sternocostal joints. And next we'll palpate the ribs and the thoracic spine posteriorly. Do you mind crossing your arms in front of you? Thank you. So palpating the ribs and palpating the thoracic spine.
Palpation for position of the trachea.
To palpate the position of the trachea, first you locate the suprasternal notch. Then you take both thumbs and put them on either side of the trachea. The trachea should be midline, which is directly above the suprasternal notch.
Examination of the respiratory system continues with percussion.
To percuss, you strike the third finger of one hand with the distal phalanx of the third finger of your other hand. Make sure that you're having the motion come from your wrist and not your elbow. When you're percussing the chest, you need to make sure that you are percussing on one side and going in the same plane on the other side to make sure you're comparing bilaterally. Be sure to note any changes in the characteristics. And you do it posteriorly as well. And to do this, you have the patient cross their arms in front of them and bend their head forward to move the scapula laterally. And make sure that you're percussing over intercostal spaces and not over the ribs.
Examination of the respiratory system concludes with auscultation.
To auscultate for breath sounds, you want to make sure that you're using the diaphragm of your stethoscope. You're doing it on bare skin, and you make sure that you have the patient taking deep breaths in and out of their mouth. You want to make sure that you're auscultating on the same plane on both sides, so you're comparing bilaterally as you go. Deep breath in and out of your mouth, please. Do you mind lifting up your breast? Thank you so much. And again. Good. You want to make sure you're doing it on 10 fields, 4 anteriorly, 4 posteriorly, and 1 under each axilla. Deep breath. Again. To auscultate posteriorly, make sure you have the patient bend their head forward and cross their arms in front of them to move the scapula laterally. Deep breath. Again. And again.